Hello, hello, family. God bless you. It's the time you've been waiting for. Senior Talk with Clara Hubbard, your resource and information show for people getting better with age. Well, guess what? Our friends, community partners, and one of the most inventive community of helping people get better with age, none other than Zing Health, where health is reimagined, is joining us today. I'm so excited because we have a doctor, a pharmacist, and a woman of many, 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 many titles who's going to come and bring some more knowledge about Zing Health and their services to our community as they serve Indiana, Illinois, and Michigan. Everyone stay tuned. Your favorite show is back, and that is none other than what? Senior Talk with Clara Hubbard. Stay tuned.
Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
Well, everyone, as I mentioned, the time is now. Senior Talk with Clara Hubbard, your resource and information show for people getting better with age. Well, let me tell you, we have had an exciting time in our virtual green room, getting ready to bring you this broadcast. We do appreciate everyone who is watching us on many platforms, i.e., Facebook Live, YouTube on Senior Talk Media, as well as Twitter. We truly appreciate everyone who is tuning in. Well, as I say, open enrollment, known as AEP, or as some of us call the Medicare maze, is in high gear. We are here today because over the last couple of months, I can tell you, Zing Health and I, we look good together. We have been to Indiana. We have been to Chicago. We're definitely serving the city and the state of Michigan, and we got more room to grow. But we want you to talk to someone today and hear from our special guest. She is Luenetta Jackson. She is a pharmacist, MBA, director at Zing Health, which is the place where we call where health is reimagined. I just like the way that sounds. And they believe in health equity. So as I mentioned, holds a doctor of pharmacy from the University of Illinois at Chicago, and she's MBA from the University of Chicago. Let me start over. She's a doctor of pharmacy from University of Illinois at Chicago, and an MBA from the University of Chicago. She got two titles. She's a bad woman. More importantly, she has devoted her career to medication management and the reduction of drug costs for members of commercial, Medicaid, and Medicare plans. We got a couple of titles to share with you, but let me tell you, welcome, welcome, welcome to Senior Talk with Clara Hubbard. How are you this beautiful day?
I'm doing fabulous. So nice to be here. Thank you, Clara, for having us.
It's my pleasure. So we're going to be honest. We're going to go back because, as people know, we are still living through a pandemic. Our prayer is that we are near the finish line or have some form of structure where we know to go get our vaccinations and all the stuff that comes with it. But as we were talking in our virtual green room a little bit before the show, one of the things that we have failed to do, well, not failed, but when COVID hit, we just wanted to get to the next day. What is this thing that is attacking our communities? Excuse me. What is this thing that we have no idea what it is? And so a lot of us just pull back and on our disparities, which were still in place. And we forgot about our medicines. We were all self-medicating, learning what was going on. What was that like for you in your position as a pharmacist?
With Zing, as a pharmacist, we were all systems go. We didn't want any patient without their medications. We were able to actually contract with pharmacies to make deliveries and make certain that members did not, have to go out and be in the weather, because that, when that all hit, it was spring, but
Yeah.
cold spring in Chicago, but wanted to make certain that our members were safe. Also, we as our team, we were calling out to different members to make certain that they were safe, had what they needed. Also, if they needed to have, foods, we were able to set up and getting foods delivered to their homes as well. So we think of our members as our relatives. So pretty much, it could be our aunt, our uncle, our mother, our grandparents, even a sister or brother. So we all know what it's like to be a caregiver. We all
Yeah.
do, and so we know how to anticipate, right? And that's one of the things that I think Dr. Whitaker is so great with doing, is anticipating the need and looking forward, thinking is how we can, operationalize something that's going to really be beneficial for all involved, and especially the member, the patient is who we really care about, and we want them to have the best outcomes possible, in their health.
Absolutely. We met at the at the Black Women's Expo this
Right,
year,
right.
and there we had some strong panels. I mean, we brought the guns out, and we had so much wealth of information. What I will say is, being in the community over the last couple of months with Zing, it's been like having a Medical Express Medicare card. You know what I mean? There's not too much that you all have not covered, especially with hearing from one of your ambassadors, as well as myself, Luenetta Peters, who said, Zing just took care of it for me. You know, medication reminders, maybe, but also the well-being checks. Hello,
Exactly.
well-being checks. That's is a standalone service in itself. So even beyond the plan of care, you still were seeing about their daily regimen of needs, and Zing stepped in. So let me tell you why I work at Zing Health.
Well, Zing Health is the epitome of service. Service to our community, service to the members that we have it in our plan, but also our colleagues as well. So I've been a servant, throughout my life, as a young person, and throughout, just to be able to help. So it really, and this Clara, how good it feels to help somebody, and then to have that, know that you've done something that really made a difference in a person's life or people's lives. And I think with Zing Health, we're able to, improve populations and of people, and with different chronic diseases, and also even acute diseases as well. So we're very engaged with our health care partners as well as the members, and we want the best outcomes for them.
Yes. I think what is important also is we have to tell the listeners and viewers at this time, you know, we were in the community on Saturday at a veterans post, and I'm so thankful to the team of Zing. Sadia Young, Selvey was there, and
Yes.
she's the vice president of sales and marketing. Then you have the top players in the community as far as your representatives, and then you have the president himself who comes in,
Yeah.
Dr. Eric Whitaker,
Yes.
and make themselves available. That's what I like about Zing, because it's we're reachable. We're not opposed to being anywhere to serve. And the key thing that we must always communicate is, come talk with us. Even if our plan is not right for you,
Right.
don't remove yourself from finding a plan together. We'll find something that works for you or put you in the right direction. Who does that? Because sometimes we can be very selfish, very, very selfish. Now, let's talk about the open enrollment period. It is in high swing. There is no room for error. There is room for information and education. That's why we're here today. So let's talk about open enrollment. How does the pharmacy program at Zing Health step out among the competitors?
Well, first of all, our pharmacy benefits rival all of the top, insurance plans. We are right. We got that covered. Okay. One of the things that we do as well is that we look at, the quality perspective for Zing, because that's, quality and outcomes go hand in hand, right? So you have good quality, you have great outcomes.
Right.
So our formulary is in place to actually go towards those STARS measures, which are the quality measures, to make certain that our members are getting what they need, also receiving the medications and the services that they need, at the time. And also CMS, taking advantage of what CMS is also offering, is providing for our diabetics as an example, and actually this month is National Diabetes Awareness Month,
Yes.
is that if patients are taking insulin, the maximum cost that a member would pay for insulin, in 2022, we have some it's $35 for insulin. So the federal government recognizes the value of first blood sugar control and appropriate therapies to reduce untoward effects. So they're really providing a relief, and even through this coverage gap, it will be at $35. No, the insulin price will not change. So that's one of the conditions, that one of the things that we're doing. We obviously outreach. We provide foods for just after discharge. We make certain that people get rides to the pharmacy to pick up their prescriptions, or there's delivery. So we think about just about every aspect that we can think about how we can help members feel comfortable, better, improve their quality, and they can think about some of the fun things that they like to do, in their lives, other than, health is most important, but if you get that covered, you can do some of the other things that you like. So.
Absolutely. So this diabetes thing, I've had so many people, when you're telling me $35, I'm like, I wish I could just pay that for someone. I've had one client who said his medicine was just so out of pocket. He was making a decision that he didn't want to have to make.
We have in our lower tiers, we have design our formularies so to actually cover all of the medications that would be value based and evidence based, at the minimal or to zero copay. So that's one item for sure. Insulin is again another drug that we're using or have available for members at a price that is not out of control, because if you don't control the blood sugar, there's down the road effects, eye problems, foot problems, and that kind of a thing. So kidney issues. So we want to make sure we take care of that. And then the thing about diabetes is it's just not one disease. It is like a cholesterol management. What is your cholesterol? That's important as well. And what is your blood pressure? What are you taking to? Your sodium level. How many fats are you eating, and sugars and things like that. But we do have that avenue in place to make sure that that patients who need insulin can get that, and it's affordable.
Absolutely. Mm-hmm. As we talked previous, one of the things that I could always say as broadcasting through the pandemic is I'm glad that I have this show, that I was given this show to be a resource to our older community or people getting better with age, because we have forgotten about our daily regimens. We were trying to get to the next day.
Yes.
And so we thought about the medications now, and maybe we didn't take them. I don't know, the cost alone, people are making decisions about cost in medicine has been dramatic. Wow. And I know we need to just tap into that a lot more in depth. And I would suggest that they call our number here that is scrolling on our screen. And that, of course, is 844-937-9464, or visit yeszing.com.
Right. And just for patients to know and members to know as well, we provide, per CMS's rules, we provide information about our formularies. That's all on our website. The annual notice of changes, we're going from 2021 to 2022, and you can see the enrichment of of our benefits at that time. So that information is also on our website, and it's for members or prospective members to review and compare.
That's great. So what we're going to do now is we're going to take a quick little commercial break.
All right.
And this is showing us in action. We are here live. This show, this excerpt is from our visit at the Black Women's Expo. Okay. Everyone stay tuned. Now, that was from the Black Women's Expo this year. That's where we have the phenomenal panels. But we also were in Indianapolis. So let me show this one. Everyone stay tuned. So I just wanted to show that because let me tell the community at large, there are a lot of ministries who are watching our program. Let me tell you, if you're having an event, please give us a call. First of all, you can call the Senior Talk office to get a connection to reach someone at Zing Health so that we can send them out. A lot of people are still gathering together in safety, but the key thing is please do not you can watch a commercial. They're definitely viable. Everyone's talking about Medicare, but definitely call an expert, someone that's going to navigate the process with you, give you education, and put you at a knowledge level where you're comfortable. And we must say, we're not selling anything. We are informing, we're educating, we're asking you to give us a chance to serve you. This Medicare maze, I tell you, if we don't use the benefits that we are already entitled to, that we paid into, hello,
Yes.
it belongs to you, it would be a great idea to do just that. Get someone to your community event. I don't care if you're a red hat, as I said, the pink hats, all these hats gathering. And we were just recently at a veterans post. Veterans have a big, big responsibility in our community. And we always must say thank you for your service. But let's talk about this. There's been this thing where we hold on to medication just a little bit too long. I see. Oh, it says 2020. Can I still use it? What is that thing? We keep medications a little bit too long sometimes.
Yeah, no, those medications, the expiration date is actually the manufacturer's expert opinion, knowledge and testing of when the medications might lose some effectiveness, right? And so, but the good news for those people who have all these medications, that they are not using, but just are clogging up some of their storage areas or their medicine cabinets. Mm-hmm. But Medicare has allowed, and Zing will have, for facilities to actually bring your medications and have them disposed of. And
yes.
So that way, so that reduces confusion. Obviously it's for safety as well, but that way you don't have all that, clutter, I'll call it. And then you want to use you want to take what you're supposed to be using. And that way you follow up with your doctor, your annual wellness visit, you bring your medication list with you, or you bring your medications with you, and then just make certain, to follow the instructions that the physician or prescriber has for you to follow through.
So knowing Zing Health the name is still virgin to some communities, but you're still impactful. That doesn't mean we haven't done and made things happen for several people, and we have more clients to receive. As I mentioned, I'm going to show this little background. We are serving what? Indiana?
Yes.
West Indiana, Illinois, and Michigan.
Right.
And we're coming to a state near you. You can believe that I already heard a little pre-announcement, but I'm not going to mention that today. Yeah. I heard a little pre-announcement. So why are we now looking to say, a lot of us just don't like to take medicine, even though we need it? Are there any variations of medicine? I mean, some people say they have some that are rubs, and I don't know how that works in the skin. Some of us don't like the oral pill. We don't like the gel, the powder, whatever. So what is your suggestion? Because we need it.
Right. So then the good news is that, talking to your pharmacist, right? We all your pharmacist, of course, your prescriber, your doctor, to to see what medications you can combine. There are some medications that, maybe you're taking a water pill and a high blood pressure medication that's already available in a combination. So that saves some space. It saves, you can take it once a day. That's another thing that we have. Having medications that last 24 hours, even the insulins that we that are on formulary, and also that Medicare is covered for that $35. Those last 24 hours. They have a 24-hour duration of action. So once a day, I think we should brush our teeth at least twice a day. But if you have to take your medication once,
Yeah.
that would be great. Also, too, talking about Medicare and then brushing teeth, it makes me think about cholesterol and plaque. So another thing for diabetes, and this that has to be managed, and it's a constellation of the illnesses, is cholesterol. And so those medications are so important to keep your cholesterol under control. We know that everyone is, shopping at the grocery store around the perimeter, and not up and down the aisles for the foods that really have the value.
I got it. I saw myself in the shop, in the store, as you said it. That is me. I'm on the outskirts.
Yeah, just all around. Everything we need to eat is on the outskirts of the store, not up and down the aisles. I know we might have to get maybe a little flour or something every once in a while, but really to keep our best health, plant-based for sure, it's important to look at that and also watch the fats that you eat. So that's one of the things that we do. As patients get better and they're taking their steps, or they're maybe riding a bike or doing some of those things, you can see that medications can be reversed, or lowered and also discontinued, try to get serious. But it's a process, one step at a time. And with any change, you do have to work at it, right? But it's not, you don't. One of the things I think we try for success is to really make certain that the patient member has the goals that they have in mind. That's one of the things about Zing, is the member is in the driver's seat, but we always consider that there's no one really talking at you, but we're talking with you. So that's, we really take time to listen to the member on our one-on-ones with them. Members do call in, they have questions, we're able to answer. Even now during AEP, they'll say, well, I have this list of medications, what do you think? And we can give them that information.
That's beautiful. I think that's critical, because sometimes missed medications will make you feel ill.
Yes.
And what I really would like to see, most people just get the prescription, pick it up, and the pharmacist may clearly ask them before, do you know how to take it?
Yes.
Some of us will just walk off and think, why not become more knowledgeable? I think that's the key factor, is learning. I wouldn't take a prescription not knowing. I mean, you know what I mean? And they would just walk away. And he or she would clearly say, well, Miss Hubbard, do you know how to take this? Oh yeah, I see it on the paper. Some of us are so not open to more information. That's not cool. We need to get the most for our dollar. You've paid into a lot of things we're saying, and people are offering that service. I think it's great. Now, what I need to know, what are the testimonies that you can share? There have to be testimonies from patients, clients, just community people that you've worked with who say, you know what, this Zing Health is all right with me. What would you say?
Yeah, we have members call in, and they have a situation. They call in, they need they lost their medicine, right? That's one of the things that happened, and then they lost their medicine, so they need a new prescription. Well, we actually have already in place, an avenue to get an extra fill throughout the calendar year. That's so people feel good about that. If they're out of the state or out of the area of which they typically live, and they have an emergency medication, that's they can have that prescription filled outside of the state in which they live. So that's more of a global coverage for sure. Members also say that they feel better just by knowing that someone's going to call them, because we a lot of times they have kind of involved conditions, and they need to you can't get it all done in the first call, so then we call back, and then patients, oh, are you going to call me back? Oh, yeah, we're going to call you back. And we called them back. Okay, I was waiting for you. So, we kind of, it's that kind of mutual admiration, if you will, and then we actually develop relationships. I mean, with our members, some of the ones that have been there since the beginning, we obviously know them very, very well, but
Yeah.
also we're available and open to, answer questions, go troubleshoot if need be, we're calling, the prescribers and helping with the pharmacy as well. So we really are making our, way out there. We, with throughout as a new fledgling and growing company, we really are making those inroads. So we, like this, we're talking today, this is an opportunity for people to learn.
Absolutely. So what we are going to do now is I'm going to share this last video. This was from Saturday. We were at the American Legion Post Giles 87 in Chicago. And I can only tell you the reception of the veterans was overwhelming because the information given was, it's going to change some lives, literally.
Mm-hmm.
This plan, literally, I asked Dr. Whitaker, I said, I just turned 50. Is there a plan? Does Zing offer a plan for me? I need a little bit of everything y'all offering. And I can't wait. Well, I'm going to wait to, but
Yeah.
the whole challenge is it's so much to offer that you offer. And most companies, honestly, you don't have to do it. You can stick right where you are, but you go beyond just that plan of care. So let me show this video as we're rolling into a great opportunity for many people. The dental program alone, people were in shock. And then when you mentioned brushing your teeth twice a day, just think about this. Brushing your teeth, there are so many disparities that fall into each other.
Mm-hmm.
So brushing your teeth is one thing. Then you mentioned diabetes, which also now leads into possible symptoms of possibly being someone with dementia. That all it's an umbrella.
Mm-hmm.
So it all ties in together. But I just want to show these beautiful men who were part of the presentation that Zing Health did at the Giles Post American Legion 1987 here in Chicago. Everyone stay tuned. You're going to love this. It was so nice. So that was just a brief snippet, but I mean, the time and attention, I mean, many veterans said, I want some other men that you talk to. I want to refer some other people. We even want to take you to some other communities of veteran post. So that was very, very nice because we're talking, I think the dental is available day one.
Yes. It's everything available day one.
Yes. Ain't that something? People were
Mm-hmm.
screaming. I mean, and most people, not first thing, but one of the things that we're very sensitive is about our teeth and our smile.
Exactly.
To know you have that much coverage, we're talking with over $2,500 to $3,500 or something like that. Don't quote me, everyone, but I'm just saying, day one. Mm-hmm. Sometimes you got a waiting period that you just don't want to wait. So this is available to you. So we are wrapping up our show. You've been so fruitful. I know we're going to come back and do maybe a gumbo show in December.
Oh, yeah.
Telling everybody, boom, boom, boom. Let's talk about part A, part B, D. Let me tell you, let's talk about open enrollment, pharmacy. We're going to talk about also, we're going to come back because Zing Health has this critical health component dealing with heart disease and many other things. They haven't left anything out. It is like a cruise ship for Medicare. A little bit of this, a little bit of that. All the information you can get with some nice smiling people. So, Dr. Jackson, would you be so kind as to give us your closing remarks at this time?
Well, just I'm so glad to be here to share Zing's Health and also the Medicare benefits that we have available. We are very dedicated to our members. We want everyone's health outcomes to be improved and feel better. We're excited to serve. Please call us if you need to speak with the pharmacist. We're here. we're here to serve, we're here to help, and if anything you need, we can, and we do follow up. So we want to let that be known. We want everyone to be well and enjoy, take rest, drink their fluid, get their rest, and drink as much water as you can. Just to keep yourselves as healthy as possible. But also, to one more thing about the OTC, because we're getting into the fall season, just want to make certain that we do have over-the-counter benefits that you can buy your vitamin, and vitamin D is very important, especially in people in our, and at this time of year, because people are not getting out for the sun. So make sure you can get all your vitamins to help to keep your health maintenance up.
Mm. Well, we're gonna come back. I'm gonna talk to you after the show. I got something that's really impactful. Um, excuse me, that I want to talk to you about. So we can do that in December for our gumbo show, because we're gonna bring everybody together. So everyone, it's been a pleasure to serve you. I'm your granddaughter in the community known as Clara Hubbard. And please remember, in complete darkness, we are all the same. It is only our knowledge and wisdom that separate us. Don't let your eyes deceive you. For more information on Zing Health, bring them to your community, your party, they will come. ZingYes.com or 844 Yes Zing. We'll see you next time.